So it's 4 p.m., so I want to respect everybody's time. So welcome to our Data Science and Health cluster. We wanted to introduce you to our new cluster, and also an exciting thing that we've been also working on that arose out of the COVID Data Science Working Group, a metadata platform for UBC. So I will be one of 3 presenters with regards to this, and very excited that you're here, and thank you for making the time to come to this session. So we wanted to give some context. So as you know, data science is transforming the healthcare, but the potential of it is really dependent on access to health data. And currently in BC, we have a fragmented healthcare and data landscape. Part of it is due to having multiple health authorities with varied operational processes, and also privacy and governance concerns that it's clear that the processes are not uniform. So that does provide many challenges to researchers. And COVID has really required rapid access to data across multiple jurisdictions in order to speed up health research. And it really highlighted a number of challenges that we face, and it's demonstrated that research in the health system opportunities could be enabled by unified data and a regulatory framework, such as one that's in the UK. And also, COVID has accelerated efforts to align resources and initiatives to build what we want to have, which is a learning health system. So we're going to describe UBC's new Data Science and Health Cluster, DASH, and it was funded as an emerging cluster from the VPRI's 2021 grant GCRC competition. And you know, our vision is to develop a harmonized data ecosystem in this province that can accommodate multimodal and multidimensional data to enable data science applications that will advance health. So the leads have been myself, Dr. Sang, and Dr. Anna Meredith. We're supported by a wonderful team, and we represent the 2 campuses at UBC, 5 faculties, 18 department centers, and existing clusters, 4 educational programs, as well as external stakeholders from the Ministry of Health, provincial health authorities, and industry partners. So we're unified by the aim of overcoming data access hurdles and applying data science in health data at scale. So we will not have as much of a grand vision in starting out, but like that's hope. We hope we'll get there eventually. So we thought that we had a great opportunity for UBC to lead in this space. And I think this slide really highlights the opportunities as well as the complexity. So UBC is a single medical school, and it serves every health authority and region in the province. We're involved in healthcare delivery and training of health researchers, allied health professionals, and physicians. We have a strong translational research focus. UBC is integral to the creation of health and health research data, and we have representatives from key UBC units and health authority stakeholders involved. We have a strong foundation in data science, and I think we can illustrate that we have many of these partners in this space. We have impressive institutional level investments in infrastructure. We have pathways that are established to support innovation, but we do have silos of expertise and underdeveloped linkages with medical training and health research infrastructure. And building collaborative networks and aligning efforts will enable the development of unified health data ecosystem. And really a transparent unified ecosystem will enable collaboration with external partners keen to access UBC's expertise and leverage clinical expertise in health data. So these are our 4 objectives. The first have to do with data assets, and this is where we're going to do much of our demonstration today. And what we aim to do is a systematic, comprehensive landscape inventory to develop a metadata commons to broaden the impact of existing data. And then also this metadata commons will align with the Tri-Council's research data management policy expectations, which are very similar to what NIH expects, and also provide a platform for engagement with external collaborators. And when we talk about data assets, we're going to start with health research data assets. The second are data access. That's our objective around mapping the access and approval process internally and at partner organizations. And obviously have engagement with the health authority partners to identify barriers and develop harmonized processes. And obviously the considerations of privacy, legal agreements, and operational approval. And a lot of work is already being undertaken between the Faculty of Medicine, health authorities, and with the clinical research coordinating initiative for COVID. So we would like to support and be part of this initiative. The third objective has to do with data analytics and doing a strategic assessment of the existing and planned infrastructure platforms, develop an enabling framework, and look at and get an inventory of the computing resources, clinical and data science expertise, and a strategy as well as partnership opportunities. And hopefully with this environmental scan and details, we would be in a better position to propose a CFI in this space. And finally, data literacy and cultivating it through new educational programs in collaboration with the DSI, and continuing professional development programs for clinicians and researchers, and integration with undergraduate and postgraduate medical education in order to train the next generation. So the COVID Metadata Commons, it's this project, like I said earlier, was funded from a UBC Faculty of Medicine COVID-19 Strategic Investment Fund that was awarded to the COVID Data Science Working Group. And this really was a project that had multiple stakeholders, and it really centers around developing and implementing a metadata framework and collection system for COVID-related data sets in this province. And I think the important thing is this would allow us to leverage our common research interests of COVID and create a platform that we can catalog, share, and discover the metadata. It's going to be focused on research collected data sets that are public facing, and user-friendly, lightweight, semi-automated approach is what we're hoping to do. So we also hope it'll inspire a new way of working that'll extend beyond the pandemic. So I will first introduce our MHA candidate, Sarah Lynn, who's been working with us, and she'll be demonstrating the Metadata Commons and providing the project update. And she'll be followed by computer science student, Jason Hall, who'll review what the principal investigators would need to input and also require for data verification. And then this will follow with a discussion led by Dr. Kim McGrail, who's the project lead. And we are keen to hear your thoughts about future contributions and uses of the platform that we aim to pilot. So I'm going to hand it over to Sarah now.
Thank you, Anita. So yes, we have many reasons for honing in on metadata sharing. So one of them being that metadata is very strategic. It's a powerful way to jumpstart collaborations because the stickier considerations such as privacy is kept to a minimum. It's also a very necessary first step towards the grander vision of data sharing in open science. So here are some potential use cases we imagined for the metadata consumers we're aiming. And the anticipated consumers are PIs and research groups, potential industry partners, government agencies such as the health authorities, and trainees or students. So of course, this is not an exhaustive list. There are many other uses possible, and I won't go into details here in the interest of time. So I'll just let everyone do a quick skim for the example use cases. All right, Anita, next slide. Okay. And now I'll quickly go over some desired design and features of the platform that guided our decision-making in the selection of our tool and framework. So first, we wanted to make sure that users can conduct both basic and advanced searches of both study level and data level metadata without the underlying raw data. So we wanted to look at metadata without having access to the original primary data. Users should be able to find a variety of provenance information on the research context and design, and they should also be able to find more granular information, such as labeling and the documentation of names and descriptions of variables, explanation of codes and labels, for example. And Anita, if you just do one more click. All right, so our chosen tool for the platform is the Maelstrom and the Obiba set of tools. So our sandbox is developed using the tools from Obiba. It's an open source suite of applications that supports data catalogs and study harmonization. And Obiba is part of the Maelstrom research program, which is headquartered in Montreal and led by Dr. Isabelle Fortier at McGill. And Maelstrom is an international team of scientists, statisticians, and computer scientists. And our main reason for choosing Maelstrom is for its open source nature, its ease of use, and its capability for metadata discovery without underlying data. Okay, so I'm going to toggle over to a YouTube video. I'm going to show a recording of the demo done not too long ago to the CRCI data science node on how to browse and search on the Sandbox platform through the lens of a metadata consumer. And the video is also up on the Dash website. Give me a minute. The landing page of the Sandbox. Could everybody hear? Yeah, okay. It's hosted on a tool called Meta. Jason will go into that later, but essentially Maelstrom also looks in a similar format. So immediately these boxes up here correspond to that schema levels we went over earlier. So here they correspond to these levels. And I will just start by giving an overview. So going into the studies page, you'll see an inventory of the studies available and their brief study descriptions. And at the current stage in our development, we have a few made up entries with demo data, as well as 4 real study entries. And the 4 real entries are the ED registry, the consent registry, my hearts map, and the personal impact survey picks. Okay, so for the real entries, for us to input the information for the real entries, we have to directly contact the researchers to obtain their study protocols from RISE, as well as their codebooks and data dictionaries. Okay, so now going into a study record page, you can see that it contains the study description, investigator information, study design, and information on access, and so on. These squares on the top indicate the corresponding number of data sets and variables available within that study. And then further down, a timeline is shown. This is automatically created when we input information on the populations. Each segment of the line here represents a data collection event. And then further down, you get more information on the populations and information on the sources of data. Okay. There's also variable classification. So these are the annotations that we were looking at earlier. It looks a bit funky here because we've not gone into manually label every variable yet. We are just labeling as we go for the purpose of the demo. Okay. All right, so now we head over to the search. So the search function allows for searches on different studies and variables. On the left side, these are search criteria split by the same schema levels we saw earlier, and those are also mirrored up top here with corresponding counts. These counts will change as search criteria is being refined. We'll use 2 search levels in this demo. One is the studies and the other is variables. So under studies, you can see many properties available. You can select, say, based on the start date of the study. You can select on the minimum or maximum age at the time of recruitment, and also select based on study design, for example. So for example, if one wanted to identify studies with relevant designs that would collect information useful to answer their specific research questions, they would use these kind of a search. I'll go to variables. So under variables, there's the areas of information. These are the domains and subdomains we talked about in the Maelstrom taxonomy. So you can select one, or select all, or select across various domains. And you could also filter by keywords up top. So for example, if I type in sex, it will display all of the domains that contains the word sex, which cuts across various categories. Okay, and also under variables is variable properties. Here you would be able to search for words in the variable name or variable label, and that would generate a list of variables that mention that keyword. You could also search based on the variable type and the nature of the variables. All right, so let's launch into a sample search. So for example, if one is interested in knowing how many studies are conducted on school-aged children. So to do that search, you will start by searching in study properties, and you can set a limit on the age. I could put 18. Play. So it's returned with 2 studies that's conducted on school-age children. Because we only search at the study and population level, we can see literally the count of variables available in each study without further refinements. So we can see that MyHeartsMap contains 1,052 and PICS contain 5,000 plus variables. So in this case, we would like to further refine the search. At this stage, maybe let's say we want to see in the studies that is conducted on school-age kiddos, how is sex, gender, and sexual orientation collected? So to refine the search, you would keep the search criteria, which is shown here, but you will go into areas of information, and you can find annotations related to sex. So we see there is sex and gender and sexual behaviors. So let's say we select those 2. So now we've got a further refinement of the search. And here, essentially, it's showing that there are 32 variables across 2 data sets within MyHeartsMap and 22 variables across 2 data sets within PICS. And these are all the variables related to at least one of this search criteria on top, which is sex or gender or sexual behaviors. And now, if I click on this number, it's going to take me to the variable list view, which I can also toggle using the tabs on top. And the list here shows the variable with names, labels, data set, and the study they're part of. So you can choose to download this list if you wish by just selecting all and clicking on download on top. It will create a CSV file that's the exact replica of what you see here. And if you're interested in knowing more about one variable, you can select the variable, and it will show a page on variable details. So the labels, the value types, and so on. And this is the classification it falls under. Okay, going back. And then the other note is that these counts are updating as we go. And let's say we want to do a further refinement. We want to know whether these studies collected information on COVID, for example. We could go back to areas of information and search for respiratory. I know this because I just did the tagging. Say diseases of the respiratory system and symptoms and signs. And it returns with 80 variables that will fit at least one of these criteria. There are advanced searches here. I won't show it in detail, but you could change the relationship between each of these search criteria and or things like that. Okay, and then I also wanted to show some nifty features if we actually had data in the system. Jason had put in, I think, 10,000 dummy data points, and if you had actual data, it will automatically create these summary stats tables. So, for instance, for a categorical variable like sex, it will produce the percentages and a nice pie chart. And if it was a continuous variable like age, Maelstrom will give you a frequency distribution. So we obviously this requires underlying data, which we're not diving into just yet, but this is a nifty feature that might entice users in the future. All right, Anita, if you don't mind pulling up the slides again. So that was the demo. I'm going to pass it over to Jason now, who is going to run through the workflow through the lens of a contributor, metadata contributor or creator. So that would be an investigator. And we designed the process to be semi-automated so that it's not onerous on the researcher.
Okay, so I guess everybody can hear me. So the idea is to simplify the process as much as feasible for the researchers. So along those lines is to reduce the manual data entry as much as we can. So by pulling out the data from RISE and processing what is there and putting it into a web form where the data could essentially be checked over and validated, and minimize that process and simplify it as much as feasible. The idea then is once the data is put in from the RISE dump into our system, the investigators could get an email notification that there's a study there that needs to be authenticated. And once they go through that process, there's basically a little checkbox that they can have it published into the MICA system that was just shown in the video there. Next slide. So this is a picture of what the web form looks like. The full form is on the right there. So the blue box is showing what's on the left there. Is just to cut it into some smaller pieces. The web form is meant to be to simplify the process as much as feasible. So once the data is pulled out and populated into these fields, you can see in the red box where it highlights that there's a required field. So those top 3 fields are required. So what we can see here probably is when this window was open, that objectives box was not filled in. So it was showing that there is some requirements there. Everything down on the right column will be guidelines or information on something to do with the data. Further down, what that shows is that there was an update to the RISE information that was dumped into the system. And so it's showing that there's a discrepancy between what's in the system already and what was added in differently. So at one point it was no funding, and then it was changed to BC Ministry of Health. And then on the left, for this section can be checked off once that data is approved and it seems valid and ready for publishing. So next slide. Further down the form, once there's sort of the system will figure out what the general design of the study is, since it's not really explicit in the RISE information other than text. So the system takes a guess at what's the most likely option. And if there's more than one option, it'll list the other ones down on the side there on the right, so that the researcher has the option to choose if there's one that's actually a better fit. And then further down, you can see where it says no data found. So if there's any fields that it's not necessarily an error, it's just a highlight that there was no data captured out of RISE that would satisfy filling in one of those boxes. So on the left, the section is complete checkbox can still be checked off. We may not have that information yet, but it's ready to go and be published at this time. The next slide. So it carries on. There's a few fields that weren't captured out of the RISE information. And then at the bottom, there's an option to upload a dictionary file that can be put into the system that showed a little bit in the video that was there. And then finally, there's a checkbox at the bottom that this particular study is ready to go. So the idea being that somebody doesn't have to do this in one sitting, although it should only take a few minutes, but they could come back to it. And once it's ready to go, that checkbox just basically flags it so that the whole study is ready to be imported into the MICA system. I think that's it. And then once the study is approved and published, this is how it would essentially show up in MICA that was in that video again. So once all the fields are approved, then they'll go into the MICA system and be ready for searching. So the idea is that once the study goes into MICA, it can still be modified if necessary. So if there's data missing, it can still be added in. It just simplifies the process with the web form to get it in the first place. I think that's it.
So thanks so much, Jason and Sarah, for presenting. And Kim, I would ask you if you could moderate or give some reflections as to the journey that this came from an idea and now it's manifested into something that's on a server and we hope has great potential.
Yeah, thank you. And thanks for organizing this, Danielle and Anna and Anita, and for Sarah and Jason for putting together great presentations. So I also want to acknowledge that we received funding to put this together through the Faculty of Medicine Strategic Investment Fund that was specifically run in context of COVID, with the idea that we really needed not just to do great research during COVID, but to really maximize the investment in research data, because a lot of us are engaged in many things that have a lot of value beyond the immediate project at hand. Some of that even could be for student projects and so on, but I think a lot of these things, particularly if we can triangulate pieces of data from different things, we're just going to get a lot more from our public investment in researcher collected data if we can find a way to use them. And as Anita made reference to, there are increasing expectations that we will do good research data management practices both during our research projects, but also that we have a place to put data after research is over to maximize reuse and so on. So with that in mind, it's been a pleasure to work on this project. I've learned a lot. I also am a part of which is that all of these things are far more complex than they seem on the surface. I think what we really want to do is just open up for conversation, and I would welcome questions. I would welcome comments. We want to hear the kinds of things that would attract you. So for example, what would make you want to use a system like this as a researcher looking for data, as a researcher wanting to deposit data and see your data have a second life after your project is done, as an instructor who has students who might have projects that they want to do, any insights into the functionality, potential uses, anything that you might want to comment on or question is very much open. So it'd be great if you can use the hands, just because it will mean that I'll be able to see you, because in Zoom it'll move you around on the screen. It's easier to capture, but I will open it up for Rich, take it away.
Wow, get to go first. I'm sure there's a lot of questions. That's fantastic. Really, really amazing to see that coming together. And also what's amazing is the number of people joining the call. So obviously high interest. Nice to see. So I have a couple questions. I love the fact that it's using, if I get this right, sorry, it's using RISE. Actually, is there an opt-in or opt-out to using RISE? I love the fact that it's pulling data from RISE because of the low barrier. It's going to be there. I almost hoped it's just either universal or opt-out, so that because it's just metadata, and I think it's funded by Canadians, belongs to taxpayers, not us anyway. So you could make a case, so that's one. Is it a holistic thing for RISE? And then I have many questions, but one is about the types of data that it can put in there as well, because we have a lot of quantitative research, which I think is probably a focus of metadata, but there's qualitative research. We also collect conversational data and metadata about our data. Does it collect metadata about the metadata? And just sort of wondering a little bit about the scope. And I know these are early days, but I'll leave it at those two first questions. So one is what's included in the sort of RISE connection, and then the types of data. Thanks.
Yeah, it's a great question on the RISE piece. We have not had to this point the conversations that we would need to have with Laurel and others within the REB about how we might put this in place. But what we were thinking is that there was this whole RISE export sharing of information about projects with the Academic Health Science Network during COVID, just to make sure everybody understood what research was going on. So it's clearly possible to make some arrangements, and our thinking behind this was that we need to make this as easy as possible for research teams to want to contribute their metadata to something like this, and that RISE offered us the most comprehensive way of doing that. RISE and data dictionaries that researchers might put together on their own outside of that system. So that is something that we would, so it's great to hear the comment that you see the utility of that, because that would be part of the follow-up conversations we need to have. On the types of data, I think and Sarah, do you want to answer that? I think it's pretty broad, but do you want to provide any thoughts on the types of data that this platform could accommodate?
Sure. Well, that's a great question, because I have not encountered the qualitative sites yet, but I do know, and I think, Jason, you'll be able to answer this, from the software that is parsing these data dictionaries. Jason wrote the script to parse particularly the Redcap data dictionary CSV files and convert that into what the software would need. So I imagine that being something a computer scientist can write, another script to read various types of files and convert it into the format that the software needs.
And I don't think that there's a limit on the underlying data, what it can accommodate. Certainly, we found with other systems that we looked at, they were more attuned to biospecimen data or something else, and this one seemed to be more comprehensive. Although, to be very honest, this system grew out of a cohorts space, so it's probably most developed for things that you might consider a cohort. So, are there other questions or comments? Carolyn, please.
Sure. I'm not sure if you can hear me. I'm outside with headphones. You can? Okay, good. I wondered about researchers who are not at UBC. I think there's a broad community of people who might be interested in connecting with the metadata. So that question, and then my other sort of wish list, you asked for wish list, would be a really, really, really good search function. Because I think that's often one of the barriers, is unless you already know exactly the right keyword, you don't want to have like immunity versus immunization versus vaccination versus, you might want something that it's just a really superb search, I think would be really enabling.
Yeah, it's a great point. So I can address the second one briefly, which is that the system does enable wildcard searching. So you could just type in IMMU or IMM star and get back. So in that way, it's pretty comprehensive. We haven't tested the limits of what it can do, I'm sure. On the uses outside of UBC, I mean, I think, you know, it's really hard to draw a line around a university and say we're just going to keep this private for ourselves. I don't think that would be really the motivation of Anita and her group, or the rest of us. So I don't see an issue with that. This system doesn't hold the underlying data, and each of the data sets will be associated with some plan or clarity, I should say, around the governance, who can have access to the data under what circumstances with what process. So I think it will come down to those allowances, but certainly I can't really see gating this and making this a closed system, because this is all, we're trying to live by the FAIR principles, and part of being findable is about being out in the open. So.
Great. Yeah, I hope that you would feel welcome to reach out to SFU from the data expertise side, but also in terms of researchers and the community here. And I think other universities across the province would probably feel the same, including UVic and others, just because there's a broader community there. And it's great. I think it would be really enabling to have this kind of thing across the province.
I think Anita would feel the same as me. That's all to our advantage, to be more collaborative and open across universities, across everything. Shannon.
Thanks. Yeah, it's beautiful, very exciting. I love seeing everything come together like that. So congratulations on all the work so far. So I do imaging research, MRI, and so we've been working on building an image repository for use across North America. So I was just kind of wondering about, you clarified a little bit there that this won't contain actual data, right? This is basically a way to get into contact with people to be able to then form a partnership with them and come up with their own data use agreement. Great. So one thing that might be helpful, I don't know, is if you wanted to try to facilitate some of the data transfer agreements or have like templates and that. I don't know if you've already worked on that, and I'm sorry if you already covered it, but that's something that we've been working with quite a bit with UILO, and having kind of the centers that are going to be involved look over some of these agreements in advance to kind of look at the ethics and get those things in place earlier on to make it easier to go ahead and share. So there's some standardized wording that might be helpful as well.
So I'll invite Anita if you want to say something there. I will say one of the things that in another part of my world we're working on is the data visiting kind of thing. So maybe we'll get to a point eventually where we don't actually have to transfer data, because we can enable distributed kinds of things. The data can stay where they are, but it is separate from this. But Anita, do you want to say something about Shannon's first comment about the data transfer agreements?
I think we hadn't thought about transfer. I think we were thinking more about data sharing and hoping that we could create secure research environments that would enable people to access the data without having to fully transfer it. But
yeah, we still need
early
for those, I think, as well. But yes, that's great. Yeah, no, that's really
good point. Thank you.
D.
Hi, Kim. So this is great. First of all, just let me say thanks for the presentation, and this is great to see. I have two comments, a bit tangential to this, but important just to sort of have out there. First is, would there ever be, and you don't have to answer these, would there ever be an appetite for the ministry to actually take the RISE platform on in partnership with UBC, or at least for in terms of the coordination for the province, like when we think about data sharing, et cetera, like having RISE be really truly provincial, I think would just be fantastic. So just to kind of float that out there. And then the other thing, and I'm going to credit my colleague Holly from Interior, she and I have been going back and forth on this. And this again has to do with coordination and reducing barriers for research, including data, which is going to be, you know, primary in terms of priority. And wouldn't it be interesting to use a similar process for pulling data out of RISE for operational approval as an application system? So just a couple of thoughts to think about. I know that's a little bit before, you know, that's into the planning minutia piece, but just wanted to at least, you know, in your discussions, both of those, considering the multiple requests for operational approval for one study to do 5 operational approvals, you know, again, just something to consider. But thank you very much. This is really, really interesting and promising to see.
Yeah, no, it's thank you for the comments and suggestions, Dee. And I think I saw Laurel. So Laurel, if you would like to respond to any of that, as Dee said, you don't feel obligated, but if you'd like to, I'd be happy to give you the floor.
All I can say is that there's a lot more to RISE than the study data. And the way that the data is being accessed right now is via a consent, or at least a passive consent on the part of the researchers. We tell them that it's going to go in, and that unless they object, it's going forward. But to mesh it all with right across the province would be wanting to take SFU's data and all the other academic and hospital institutions' data, and we certainly don't. Sorry, but the RISE is a UBC program, and I don't see it becoming a Ministry of Health program, although potentially it may become the only ethics platform that's run out of the province. So from that perspective, it may be helpful. But what was the second point? The second point was the operational approvals. And we do have a harmonized system, but each of the operational approvals has to go through their own individual set of, like, it's linked into RISE on a harmonized platform. If you're actually doing a joint multi-site study, the operational approval start off will come up for each of the different institutions that you're going to, but the final bit is all up to the individual institutions. And in some ways, it more or less has to be, because it's a local consideration rather than a provincial consideration. Is that making sense?
Yeah, totally. So totally agree in terms of still have to go out and ask, doesn't matter where you are. But just consider it just for future brainstorming or thinking. I know it's probably way more complicated than what I'm simply saying, but I appreciate, Laurel, your feedback.
There's no question that RISE is going to be revamped or redone within, you know, the next 5 to 10 years. And there are discussions around sort of taking the ethics piece of it and making it provincial, and then keeping the rest of it UBC specific, like the conflicts and the grants and stuff. So.
Thank you. Any other questions? Comments? Things you'd love to see? Anita, were there things you wanted to add about your plans for data finding and so on?
Yeah, so this is a pilot, and we would invite PIs who have data sets that are in RISE or otherwise, and have data that's in Redcap, or the metadata, I should say, and data dictionaries. If you would be interested in participating in this pilot and allowing us to populate the Metadata Commons with your data, your metadata, so we can work out the bugs and see what works and test the functioning. So that would be one ask. We would have the PIs here to participate. It would be, you'd be really helping us to work through the bugs, especially if our vision is to have this to be a bigger platform and include many, many more studies. And it also would help us prototype this so that we're prepared for 2022-23 when CIHR requires us to have a data management plan, and this platform could service that as well. So it's to our benefits on multiple levels in terms of increasing our collaboration and understanding what data are out there, as well as fulfilling Tri-Council policy funders, NIH, and also, part of the Academy of Translational Medicine for UBC, the vision is to have a data commons, but you really can't have a data commons until you have a metadata commons to start with. So those would be the things. And I think in the chat, Danielle has put in the email to contact us. And the other thing is we really want to get engagement with you and want to get your feedback and ideas. And this is a grant to catalyze participation and collaboration. So we're very much open to feedback and ideas. So
thank you for that. I would, maybe I'll just see, while we wait to see if there's a couple more questions, I will say that I don't have a comprehensive understanding what's happening at other universities by any stretch of the imagination, but my sense is this is going, if we do this right, we will be way, way ahead of the curve, comparatively speaking. And if there's a way that we can take advantage of that and really help UBC achieve some things that people are keen on, that this sort of platform and all sorts of other research infrastructure will help, I think that's going to be nothing but to our advantage. Sven, please go ahead.
Hey, y'all. Sorry I'm late. This looks awesome. From a PI perspective, like what exactly is required to sort of share that data or share that metadata? Is it just a CRF, or do you need anything more than that?
We would need, it's the CRF. If you're using Redcap or something like that, would be brilliant. Jason has worked on a little bit of a connection to Redcap, so that it's something that we think could be automated, the connection between the OBIBA software and Redcap, so that would be easy. So it's permission, provenance information to complement the information that's in the CRF. And then ultimately, I think what we're going to need to have is what we talked about before, which is like the governance information. So who would you be willing to share these data with, under what circumstances, and so on. So we're really trying to design the workflow in a way to make it as minimally invasive and needy of the PI as possible. We're trying to limit it to permission and what you might have in hand already. I thought that might appeal to you, Sven. Elodie, go ahead.
Hi, hi Kim and Anita, and congratulations on the launch for Dash. It's great, and it's great to see the Metadata Commons in action. I was thinking, since we have a very similar system at BC Children's Hospital, and I know we've shared our workflows with you guys, but we also get data from RISE. We also use MICA for our study catalog. And on top of that, we also store information about which of the studies actually use Redcap in our institution. So I think we have there a good ground for identifying potential investigators that could be good candidates to populate the Metadata Commons. And I think we could definitely partner in a campaign for reaching out to these investigators and finding out who would be interested in participating. But we definitely have a good soil to fertilize this this project, I think. So I'm looking forward to partnering in the future.
Thank you so much. That's fantastic.
Yeah, and just to underline what Elodie said, fantastic, really collegial, helpful, multiple meetings with us at the beginning to go through the, I would say, some of the pain points of your development process, as well as some of the successes, and it really helped us kind of leapfrog. So yeah, we should definitely carry that on for sure. Rich, go ahead.
Hi, yeah, what are the other questions? I was looking for clarity. The Maelstrom you said is hosted and developed out of, I think McGrail, is that right? And then Micah, was part of it, or was that something that's independent, that separate? I was just looking some clarity on that, and then I have another question.
Yeah, so Maelstrom is a consortium of people who are really interested in data harmonization work, and that's led by Isabelle Fortier, who's at McGill. And the software is collectively called Obiva, and it has two components to it. One is Micah or Mika, and the other is Opal. And one kind of handles the top end provenance sort of information, and then the other handles the more study catalog, data variable kind of information, and then they interrelate to each other. So it's Micah and Opal are the software pieces, or Obiva if you put them together. Okay. And so it is completely open source software. So we've actually installed it here. Obviously there's a cost, as in any software, for maintenance and upkeep and so on, but it is open source, and it does have a bit of a development community around it. It's pretty active still. So for example, the Canadian, what's now called CanPath, the former CPTP cohorts, the Canadian Longitudinal Study on Aging, the Healthy Hearts and Mind cohort, the child cohort, they all use the same thing, which kind of opens up another potential opportunity for collaboration. So okay, sorry, you were going to ask something else.
Yeah, no, so just to that, it's so downloaded here, meaning the data itself, like the metadata about the studies, is it hosted on the cloud or at UBC, or it probably doesn't matter, but yeah.
It's at UBC.
Okay, so the question I was going to ask, which is beyond, I agree the nice starting point of using RISE as an institutional wide data set is probably most manageable and wise. But there must be interest also from CIHR, Michael Smith, and so on in tracking and monitoring the types of data and playing a role. Do you see that as something in the near term, or maybe an interest that sort of develops over time?
So I think CIHR definitely has an interest, and it will be an increasing interest. This is part of the reason that tri-councils are all coming out with research data management requirements. We've had deposit requirements for primary collected data for a while. There hasn't been so much enforcement of those things. But of course, we spend a lot of public money collecting data, and if it can have more than one use, that's obviously a really, really good thing. So this is where I think we have an opportunity. If we're a little bit ahead of the curve, we're putting this in place prior to the actual institution of those research data management expectations. We know they're coming, they're not in place yet. So I think if we can keep going in this way, I think we actually have an opportunity to shape some of those conversations and to suggest to CIHR and Michael Smith Foundation what the opportunities might be. And maybe in that way, find some others who are willing to invest and help us make this even better. So that's vaguely the way I'm thinking about it, Rich. But if you or others have thoughts on that, I'm sure Anita would be really interested in hearing them in the context of the Dash. Any other questions? If not, I'm going to hand it back to Anita.
I have a quick comment I could make on that. One of the factors with using that particular system, and part of what makes the whole web form process feasible, is because of the import and export capabilities, which means that we could potentially take data such as RISE is only one example, that take data from other sources that are persistent and formatted in ways that it can be imported on a somewhat automated basis. So there doesn't necessarily have to just be a single source of that metadata. It could be coming from other sources as well.
And Jason's right. The idea is we started with RISE and Redcap because those are systems that hold lots of data, metadata. And so it's obvious that you might want to create automatic pipelines for those, but those are not the only ones. So thank you, Jason.
Thanks, Jason. That's
Okay.
helpful. Thank you, Kim. Are there any other questions? Was it that clear? Well, Sarah and Jason and Raymond and Kim have worked hard on ensuring that it's clear, and I have to thank Danielle as well for helping organize this. So we will send around to everyone who signed on a link to a survey. So one of the surveys from Sarah, and she wants to get feedback on the metadata presentation about our Metadata Commons. And the other survey is from the Dash group because it's our engagement survey. So if you could take the time, they're both not long, to fill it out in the next couple of days. Actually do it immediately, because if you wait, your inbox will become full with other things if you're anything like me, and you'll forget that you had a survey. But we are delighted to have all of you show up for this demonstration and for this launch. And we look forward to having more events like this. And maybe one day, many of us can actually get together in person. Hopefully that's coming. And also just a message to everyone to make sure you take some time off. I'm trying to tell this to everyone whenever I can. Please take some time off during the summer and take care of yourself. It's been a very challenging year for people. And I think our mental health is worth investing in. And we'll give you some time back so that you can go out in the heat and the sunshine, but please use sunscreen. Okay. Thank you very much, everybody. Take care.